I think that if you think about the traditional way of psychotherapy, we would used to play with children on the floor and hope that we would get a better understanding of what the child was feeling and thinking. Unfortunately, many times the child would behave very well on the one-to-one, and it wouldn't be able to generalize in the outside world. And I think that anybody who has ever been in personal therapy as an adult, again, is able to share their feelings, but wouldn't it be wonderful to have the psychiatrist inside your head? And here, literally, we're putting a parent coach or a teacher coach into someone's head. And what we're planning, by the way, is we're wiring our new home. Our new home is going to literally consist of over 23,000 square feet of space, and two things will be able to happen. So that A, long distance will be able to coach, so that if you're able to look on a screen and the cameras are set up elsewhere, we'll still be able to do that. And number two, if you treat a child intensely, so for instance, a child has terrible obsessive compulsive disorder, they can fly to New York, they can stay in a hotel with their parents, they can get 3 to 5 hours a day of intensive exposure and response prevention, which really works. They might be able to get some medication, and then they go home. Well, how do we see them? With a Skype. A secure Skype line, they can get a booster session a week later, so that they don't have to come 1,000 miles, 100 miles. So that's what I mean by transforming mental health care for the world's children. How do we change the delivery, and simultaneously, how do we train people? So the most important piece, I think, is that parents need to know more, and our website, which will launch in November, hopefully will be the destination, a non-commercial, interactive website that gives scientific sound information about mental health, not only from Child Mind Institute personnel and faculty, but from Columbia and Harvard and UCLA, the experts from the world on our website.
Just wonderful. And I look forward to it. And I think professionals, not just parents and children, but professionals need that kind of support and information as well.
And I think that's the other piece. There are only 7,000 practicing child psychiatrists in the country. We're not going to produce more. We have 3,500 psychologists who classify themselves as child psychologists. And therefore, those individuals are usually working very, very hard because children take up more energy, they require school visits, they require parent coaching. So therefore, we need to expand the Army. And the way to do that is to train pediatricians, to recognize and to treat some of these disorders. We have to train school nurses, and we have to train teachers. So by doing this on the web, it'll be more efficient. People can do it at nighttime, they can do it at home, and we think we could really be a wonderful resource, literally for the world, by doing it this way.
Yes, it sounds wonderful. I have just two questions. Sure. One is, what would you say is the most prevalent mental illness among children today in this country?
So I think there's two, and it all depends on the age. If you're talking about very young children, disruptive disorders, and about 5% of the population at any time has attention deficit hyperactivity disorder. So 1 out of 20 kids really has a very short attention span, inability to sit, and is very impulsive. And we can actually show you differences on MRIs versus a group of typical kids. Now, it's not that a 2-year-old is expected to sit. These are children who clearly are more inattentive, more impulsive, and more hyperactive than a child their age. And so that you have to get the disorder before the age of 6, and unfortunately it's a lifetime illness. And it doesn't mean that you can't pay attention, but it means that you lose your attention span very quickly when it becomes boring for you. In other words, boring for all of us makes it hard to pay attention, but chemically we can produce the right neurochemicals in our brain to pay attention. The other more common illness, which again I think is minimized by the public, is anxiety disorders. And I think that since anxiety is something we all experience as normal, we're nervous, something bad is about to happen, or something good is about to be happening, but anxiety disorder, the real difference is distress and dysfunction. It lasts for more than 2 weeks. It's a set of illogical worries that we can't shake, and it affects our behavior. And this, unfortunately, occurs in about 6% of the population, somewhere between the ages of 7 and 16 at any time. And that's a conservative estimate. And very often, these kids don't come to see a child psychiatrist or a mental health professional. They actually land up in a pediatrician's office because they have headaches and stomach aches. And you can't find the organic, cause, but their stomach ache and their headache is still real. but it's caused by this anxiety, this misfiring of the amygdala of their brain, or the locus coeruleus of the brain, which thinks there's a fire, but there is no fire. Or they think there's danger, and there is no danger. And unfortunately, this often is mislabeled or minimized, and with the hope that children will outgrow it. And unfortunately, usually kids will either treat it themselves, or will start limiting their lives. They won't sleep out, or they will start to refuse to go to school, or they will be so fearful before a test they won't take a test. And the good news is that there's so many psychosocial interventions, really terrific interventions that work. So for instance, children who are selectively mute, who have a form of social anxiety, who will not speak to strangers, meaning they won't answer a teacher, they won't talk to grandma or grandpa or the neighbors, only to mom and dad, that literally, with intensive behavioral therapy, within 5 days, you can get those children to relax and to be able to do brave talking. We call that program the Brave Buddies program. But again, to do it in a fun way, to take the shame away from it, to make parents feel less shameful or guilty that they've done something, and let the child enjoy kindergarten or first grade.
Now, if you don't treat anxiety disorder, does that later in life become depression?
So it's really interesting. Children very rarely have depression. Teenagers and adolescents have depression, and there's a few things we know that put you at risk for depression during your teen years. And the number one thing is having a full-blown anxiety disorder in childhood. So these disorders are bad for your brain. They're caused by your brain, but they're bad for your brain. So every time you have an episode, it's almost like a toxic storm in your brain. And the longer you keep it, the worse the outcome is. So we know that, for instance, if you have one episode of depression as a teenager, you're 60% more likely to have a second episode. And if you have 2 episodes of depression, you're 90% more likely to have a third. So clearly, ignoring these disorders in childhood, or hoping that it's just a phase, is actually not only a disservice to the child, it's a disservice to the child long term, to his teen years and as an adult.
Is there a national program now that you admire, that you would say they are doing it right?
Well, I think one of the reasons we decided to start the Child Mind Institute after spending 12 years at NYU, and I certainly thought that what we were doing at NYU was important, is that typically what happens, and whether it's at Yale or at NYU, is that these programs are always a PS. A children's hospital may be terrific at taking care of childhood cancer or diabetes or seizures, but it's always a postscript when you think about mental health. And when you think about psychiatry, child psychiatry is always, again, the afterthought. So Alzheimer's always trumps ADHD. Postpartum depression always trumps teenage depression, even though you're more likely to commit suicide as a teenager than you are during adulthood. And it became clear to us that in the same way that St. Jude's truly tackled childhood leukemia, so that when I was a kid, if you got leukemia 9 out of 10 times you died, and today it's only 1 out of 10 times is it lethal, we needed to create an institution that is exclusively dedicated to transforming child mental health care. And that we do that in the same way that St. Jude's does cancer, or the same way that Memorial Sloan Kettering does cancer, or that other places like Hospital for Special Surgery only does orthopedics or does surgery on the bones or on backs. And if we don't have that, unfortunately, whenever there's a cutback, whenever there's financial problems, there's always something that may appear to be more life-threatening or more important. And so that we thought that since this is in many ways the last frontier, the brain is clearly, in my opinion, the most exciting place for us to do exploration, but that if you think about the bang for the buck, that what you could do for a child who suffers, and if you can turn that around, there's just a tremendous amount of potential. And clearly, everyone realizes that if you turn around a child who was going to drop out and now stays in school, or a child who literally was so unable to focus or so unable to calm themselves down to attend school, you could really make a difference. Kids who have separation anxiety, school phobia, are significantly more likely to have panic attacks.